Hi, my name is Nydia, and I'm an OBGYN high-risk registered nurse.
If you wouldn't mind just, telling me what are some of the major concerns that come across with being diabetic and pregnant?
Well, there's a lot of concerns that come in with being diabetic and pregnant because having diabetes in pregnancy, and particularly if it's not well controlled, can increase the risk of many things with the fetus and with the mommy. These things include having a premature delivery. It includes birth trauma to the mom. It can include experiencing preeclampsia after 20 weeks of pregnancy. For baby, it could also include fetal heart anomalies, breathing complication, neonatal complication, and ultimately the instance of stillbirth.
Wow, I did not know that.
I know it's not.
Yeah.
It's not lighthearted. I know. That's what I was trying to tell him is that preeclampsia. So preeclampsia is a condition that can occur after 20 weeks of pregnancy. It's a condition of the heart. And essentially, there's many things that will have to be checked for it to constitute as preeclampsia. Some things include protein in the urine. They check your chemistry, and if your enzymes in your liver are elevated to a certain range, that can also indicate blood pressures in severe ranges in the 150s over 100s or even above 160 over 110. And it could also include severe features, being that the mom experiences not only internally everything that's going on, but the body will manifest in persistent headaches. It will manifest in vision changes, like having black coming in and out. It can also be where you see squiggly, foggy, and things like that. And then it could also constitute for nausea and vomiting after the third trimester. Pain under the right rib or referred pain in the right shoulder, and specifically swelling of the hands, swelling of the face, and or puffy eyes. I usually tell my patients is the way I would describe the puffy eyes is like if you've been crying all night and you wake up in the morning and your eyes are super puffy, but you haven't been crying all night. If that occurs and you're pregnant and in your third trimester, you need to call me. Those are just some of the things that can happen in preeclampsia. The biggest risk of this the biggest thing of this is if it does occur, that we catch it early, because early treatment to it can really make a difference. If you do develop preeclampsia, it can ultimately lead to a condition called eclampsia, and this is where you have a seizure. This could lead to organ damage and ultimately to death.
Dang, so not
lighthearted again.
Taken lightheartedly in terms of it's a serious thing. So how is having hypertension in pregnancy different in terms of or the same with risk?
Well, risks of hypertension in pregnancy include also risk of preterm delivery, babies that are small in gestational size, particularly because the heart is having a hard time pumping and circulating the blood. And so the blood carries oxygen, which also oxygenates the baby and helps with growth of the baby. So if that's compromised, then it could then cause for you to have a baby that is what's called small for gestational age, so smaller than recommended size. Again, like diabetes, it could lead to it could lead to, like I said, preterm delivery. It could lead to the need for C-sections if your blood pressures get in the severe ranges and it cannot be controlled. In the hospital setting, they will need to, deliver you via C-section or earlier than expected. It could also lead to preeclampsia because it's a condition of the heart, and then it can spiral down into preeclampsia.
Jeez. And then has there ever been cases where you get diabetes or hypertension by being pregnant? Like, can pregnancy cause those things?
Yes.
Or is that okay.
Yes. So every mom is tested at a specific time in pregnancy for diabetes, to rule out diabetes, because diabetes is directly connected to the way the hormones regulate in your body. And in the third trimester, the mommy's hormones increase. And so if they have no other risk factors, such as like obesity or other risk factors that would constitute for them getting tested early in pregnancy, then they're tested later on at a specific time in pregnancy. This will rule out. They're tested through a screening process. If they fail that screening lab, then they will be asked to have a diagnostic test to where it rules out diabetes in pregnancy, or it confirms that you are diabetic. Now it's one coincides with the other. So poorly controlled diabetes can lead to having complications with blood pressure, and vice versa. Having high blood pressure and uncontrolled high blood pressure in pregnancy can lead to you developing diabetes. So they're interconnected. They are both at risk for each other, and both of them put you at risk for preterm delivery. So it's kind of a trifecta.
Hey, a bad trifecta.
Exactly. Yeah.
Well, that's very interesting. Okay.
Well, and the question you asked was, can you develop hypertension in pregnancy? Yes, you can. Some mommies develop, have no history of high blood pressure, and they develop it during pregnancy for many specific factors, not any one in particular. It could be social, it could be environmental, it could be oxidative stress. It could be so many reasons. It could be just the way the body chemistry is functioning with them, and they will be diagnosed with what's called gestational hypertension, which is hypertension in pregnancy, which would usually then resolve after delivering baby. Sometimes with the delivery, and sometimes there's need for treatment afterwards with medication.
Well, that's going to be my next question. Was this something that you would then live with afterwards? But it sounds like it has a treatment. Would it be the same situation with a gestational diabetes?
So both having diabetes in pregnancy and having hypertension in pregnancy put you at risk for developing it later on in life. So they increase your risk. So if you develop diabetes in pregnancy as gestational diabetes, after you deliver for the next 10 years, you're at a 50% increased chance of developing type 2 diabetes. So what I tell mamas is that when we educate them about nutrition and diet and lifestyle and trying to manage their diabetes in pregnancy through that, then I tell them this is a lifetime goal. This is not something that we're going to make a goal for you just to have good control until you deliver baby. This is a goal for the rest of your life so that you can maintain in good health, because after you deliver, 6 weeks after delivery, we will test you to rule out diabetes in pregnancy, and hoping that you don't have it and you didn't continue with it and that it resolved. But even if it resolved, you still carry now an increased risk of developing type 2 diabetes because of your instance of developing it in pregnancy. Same with hypertension. For example, there are long-term risks there's long-term risk or long-term cardiovascular risk when you develop, for example, preeclampsia. Preeclampsia essentially is an event that will compromise the heart. And so because of that compromise, once it's been resolved, if resolved, then, and you no longer have it and you no longer have high blood pressure after pregnancy, then you're at an increased risk of developing some kind of cardiovascular disease later on in life. So we educate patients to follow up with their providers with both diabetes and pregnancy, to follow up with their PCP within 1 year of delivery, maintaining healthy lifestyle, healthy nutrition, and healthy balance in life, essentially, so that they can decrease the risk. And there are some instances where preeclampsia is not resolved, and then the mom is now has hypertension just outside of pregnancy. And that's just one of the things that can occur. And so we definitely encourage to get, future care with your providers. That happens. Both having diabetes in pregnancy and having hypertension in pregnancy, or developing either one of those conditions in pregnancy, are manageable. It's not the end of the world. And we have a team here, a care team that is developed and put together when mommies are diagnosed with that. So it's not just the provider, it's not just the nurse. It includes the dietitian, the clinical care coordinator, maternal fetal medicine, our MAs. We are constantly following up with these patients and making sure that we're filling in the gaps when they are diagnosed with this, because it can be very overwhelming. Whether you've had it in the past or you haven't had it in the past, it is definitely something that is a condition or a diagnosis that is overwhelming, because it can feel like it's the end of the world. I had one patient describe to me one time, I went in for diabetic education, and she had just got diagnosed the day before, and she came in with attitude. And of course, it doesn't bother me if they have attitude. I welcome it, actually. And I know that that's a coping mechanism for a lot of people. And we began our session, and I talked to her about diabetes distress, which is something that can occur when you're diagnosed with diabetes. And essentially, it's a feeling of distress when you've been given a new diagnosis. You're then told how to manage it, and then you're then supervised on that management and held accountable for it. So what I tell my patients is, it's like I tell you how to juggle, I show you how to juggle, and then I give you the balls and I say, okay, juggle, I'm going to watch you. And I'm going to call you every 3 days, or I'm going to call you once a week, and I'm going to want you to juggle for me, and I want you to show me that you can juggle. And that can be very distressful. So having feelings and emotion of being upset, being angry, being irritable, crying, that is all normal, and it's to be expected. And the patient looked at me and she said, I was all in my feelings. She said, and I didn't know why, because I've been going to the gym and I felt like I've been doing everything right. And then I was told that I was diabetic, and I just felt like, for what? And so coming in talking to you, initially I was just in my feelings about it, and I was upset. I was upset about having to do it. And I validated that to her and saying, it's appropriate for you to feel this way, and it's okay for you to feel this way, and what you're feeling is real, and it's called diabetes distress.
I did not know that was it makes sense, though. I mean, anything where you have to make a huge lifestyle change, is just, it's going to be devastating. Because, like, even if it's for the better to have to make that change, I mean, change is scary. So, like, I would probably have reacted for a similar way. So I love the analogy of the juggling, because that's exactly how I feel like it would be received on my end, where I'm like, great, like something that I don't have the coordination for. Awesome. Yeah.
Yeah.
Well, I can't think of any other questions that might be something that would come up with this topic and whatnot. You nailed it with the common questions, because those were the ones that I was just like trying to creatively think of, like what questions I had if I discovered I was pregnant. But I think that was it. Exercise, what to eat, movements. So yeah, think we got it. I really appreciate your time. Seriously, like this, like you are like Michelle was telling me about like Michelle adores you, Swisher, and it was funny. I think it was you were editing the video from the Denim and Diamonds event, and Dr. Wynn, won, and you're in it like all excited for her. Like I loved that. Like I love that you are a hype woman for others. So and clearly you do that in your job as well, which explains why you're a highly recommended nurse. So.
Thank you for watching, and follow us for more educational videos like this. Please reach out to your doctor immediately if you're experiencing any health issues that are causing you concern.